I was a professional dancer for probably 20 years. And then I became interested in therapy work, so I'm using my body on a daily basis. And over the years, I've had many different small injuries and then a couple of larger injuries, which VJ really helped me overcome.
Can we take a look here quickly?
Sure.
See how you're doing? And then come back toward me. Try to bend down a little bit more. Do you feel that at all in
Yeah,
here?
it's pulling like crazy.
And bend backwards a little bit.
Yeah. Extension isn't bad.
Okay. Well, that's classic disc, right?
Yeah.
And go side. That means you're not an old woman yet with arthritic joints. Liz has had disc issues for at least the last 5 or 7 years. Now in her case, she's had a discectomy, a surgical intervention at L5S1. And now she's had a recurrent issue where the disc material has come out again. So basically a disc is a shock absorber, bone, disc, bone. And in her case, she's already had the disc material, it's like a jelly donut that oozes out. She's already had it taken out once. Now that material has oozed back out again in the same location, and it's not physically touching the nerve. In minority instances does it physically touch the nerve. In majority of the instances, it just irritates the nerve. It's like acid on a nerve, and it's giving her significant sciatic symptoms. And that's what's going on with Liz. So the goal here is not to get the disc back in, but the goal is to get rid of the inflammation and thus the pain and restore function. We have to figure, at your age, we have to figure out a way to put this episode behind us, because you can't be operated on all the time. You're young, you've already had one back surgery. I know your personality. You're like, I'm out of pain and I want to run a marathon tomorrow.
That's what happens. I went back to work on Wednesday and tried to go back to work. Not really back to work, but
you got to ease into it, because statistics.
out of it.
Well, statistics don't lie. Your risk of re-herniating a disc if you just go too fast into it. This is basic stuff. It's crawl before you walk, before you run. So pain relief. Then you have to start doing safe exercises like water therapy, and then you can get into the more hardcore, if you want to call that, return to sports. So remember, close to 50% of disability in our country is due to disc issues in the low back. So it's a big public health issue. The good news is there are many technologies on the horizon, including stem cell therapies for treating back pain, and very effective self-help option. Aqua therapy. Try to get in the pool and swim. I don't care if you swim an hour a day or hour and a half.
That's a long time to swim. That's like
but you can't hurt your back in the swimming pool, okay? I mean, not
That's
with
true.
a disc issue that you have. Fish oil, 2,000 milligrams, 400 milligrams of magnesium in the evening. Ice the back, and let's touch base in 6 weeks, see how you're doing.
Okay, sounds good.
Okay.
Thank you so much for everything.
You got it. She'll do at least 2 months of significant amounts of aqua therapy, being in the pool and sort of restoring the strength of the core. And she's taking fish oil, a natural anti-inflammatory, in the morning, and she is taking magnesium, which is a nerve membrane stabilizer, to minimize her symptoms, her inflammation, and maximize her regaining mobility without pain, and also minimize her dependence on narcotics and further medical procedures. So that's the type of work we're trying to do with her right now.